Dr. Melendez and Licet Valois explain how our lifestyle choices, not just our genes, can shape brain health over time. They break down how small, everyday actions can make a lasting impact.
Something that often you see in medical practice that we tend to inherit our parents' bad habits rather than inherit our parents' diseases. Mm? We might be concerned about my father had Parkinson's, my mother had Alzheimer's. Okay, that's fine. It's important to know, but you may also have a higher risk of inheriting some of your parents' bad habits. Mm? What are you going to do about it? Mm? And you know about the concept of epigenetics. The epigenetics, I was born with a gene, that gene will increase the risk of me having, Parkinson's or having Alzheimer's.
Mm-hmm.
Um, the famous ApoE4 gene. Um, Epigenetics refers to how your actions, your behavior, and the environment can actually affect the expression of the genes. You are born with a particular gene, a gene that is low penetrance. Um, you're probably born with multiple genes of low penetrance, high frequency, low penetrance genes like ApoE4. That will increase the risk of you developing Alzheimer's, depending on if you have one or two copies. One copy will increase the risk 2, 3 times. If you have two copies, it will increase the risk 12, 15 times. But there is so much you can still do because by controlling the epigenetics, by being more aware that you have those genes, then that may give you some motivation to do things in a different way. By incorporating healthy lifestyle habits, by stopping smoking, by controlling your amount of alcohol, by wearing a helmet when you are on a bike, by sleeping well, by avoiding ultra processed food, you may be just putting a layer. I mean, epigenetics, epi means in Greek above. So epigenetics means beyond or above the genes. So you are almost like spreading over the genes uh, a layer of chemical modifications that could either express the gene or could repress the gene expression. Depending on what you do, you may wake up those genes or you may keep them quiet. So even if you're a carrier of ApoE4, ApoE4 is the apoE lipoprotein is just it's a protein that transport cholesterol and triglycerides across the body, but mainly the brain. And they transport fat into the brain, and that fat is needed for the normal functioning of the brain cells. ApoE4 carriers can actually disrupt the transportation of the lipids across the brain, and it can also disrupt the metabolism of the glucose. So what you can see sometimes in ApoE4 carriers is that there is a bit of the disruption of the blood-brain barrier. So what gets in and out of the brain gets affected, and it could end up, you know, having implications in how you produce or how you use energy in your brain and how nutrients get into the brain. But there has been studies showing that people who know their ApoE4 status tends to be more motivated to introduce lifestyle changes. And there has been other studies where those who knew that there were no ApoE4, they were more relaxed. They were more relaxed in their day-to-day attitude and habits. So, but yeah, it's the genes are important, but they are no the whole story. Um, yeah.
Absolutely. Absolutely. Completely agree with you. But then here we go again. So you said that there were people that may become proactive and others didn't. So I wonder if the way that they got the information or were told about their status could also influence for some individuals to become more proactive. And my point here is, so I work in a multidisciplinary team with a group of experts that bring information to the table from different disciplines. And we wonder at time that, so we're talking about biology, we're talking about from the exercise, we're talking about from the psychosocial and emotional perspective. So I wonder if there's a specific way, regardless of the status, genetic status of the individual, to get that person more fully engaged in these type of behaviors that are going to promote not only brain health, but also physical health overall. So I just wonder, because we're talking about the social influence, so social influence in an individual to be engaged in healthcare could be negative, but it could also be positive. Could medical providers, could a multidisciplinary team be the key to promote or foster greater engagement and individuals to practice brain health care, which is the point. That's what we do. For instance, we encounter individuals who come so ready to really get engaged in the brain health care recommendations, but we have to offer. But then they realize that it takes a lot of compromise, that is not as easy as they thought it was going to be. So some people just give up in the middle of the way, but then we find other individuals that go all the way in, that go strongly through a journey. And you said it, because the motivations change, motivations are different for each individual, the goals, some people say, I just want to live many years. Some other people say, I don't want to live that many years, but the few years that I'm going to be living, I want those years to be with quality living, with quality of life. So again, that's the position that working with this multidisciplinary team that I work with, is sitting down each of us professionals from our perspective, see how we can get the individual more fully engaged and actively, to go from just the intention, the desire, to actually take actions. And these actions mean changing their lifestyles, and we hear a lot about this, and research talks about, yes, sleeping, the diet, cognitive activity, physical activity, but we also have to talk about stress, because what people really have to understand is that, going back to the brain and the functionality and the structure, is that there is such a variety of chemicals that get released in our brain through the different activities that we get engaged. And all these chemicals might have positive or negative repercussions. So it is important that we also pay attention to things like factors like stress, like, and you also mentioned that connectivity, that personal, interpersonal relationship with the outer world, and we have to educate people not only about the disease part of it, but also the benefits, the good things that can come out from people to better taking care of their brain, for people to really capitalize in the protective factors. We should not only be talking about the risk factors, changing the way that we educate people, so we can get them to be more engaged to practice brain health care. But it has to do with who's delivering the message, who are the professionals, and the way that they're delivering the message.
I'm not sure, Lisette, about whether it's down to who is leading on this changing. Obviously, the person who has to lead is the actual individual,
Yeah,
and
sure.
the only way you can change, if you realize that there is a need to change, you have to be ready. You have to be ready to acknowledge the need to change, and then you might need support from someone who is willing to engage with you and find out about the mechanisms, the neurobiological basis for which you don't feel you can change or you find difficult to change. And we go back to what we said before about those internal demons, fears, subjective bias. Also, try to be realistic. Sometimes people are not ready. What they just need is just education, information, and then for them to go away and think about it, and hope that they will come back to us wanting more information, wanted to have education, and that will help them to change their attitude.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr.